Hello, everybody, and welcome back to another episode of the AI Med Insight series, recorded live here in San Diego from the AI Med 25 conference. Today, I have the privilege of hosting Callie Ihde. She is the director of Northwestern Medicine's Ventures and Innovation. Callie, so great to see you again.
Yes, great to see you too, almost a year later.
I know. How you been since Vive?
Good. Busy. You
Yeah?
know, it's exciting. I didn't even know the term Agentic AI when we met in February, and now I probably say it 10 times a day.
It's insane. It's moving so fast.
Yes.
So what brings you to AI Med?
This was a conference. This is my first time visiting.
Same.
I've
It's my
been
first
curious.
as well.
I've been curious about and just understanding what's the angle here, who's here, what are we talking about? And I love that it was very much physician-led and clinician-led, and have just been really impressed with the caliber of thought leadership here, the caliber of folks who are both asking good questions, but trying new things, but doing it with all the right guardrails and really thinking through how do we do these things safely. But it's also been nice to be among peers who are cutting through the hype a bit.
Because there's a lot of it.
A lot of what I feel my life has been lately.
It's like everybody in the organization wants something, the toy. Like, how do you vet through that? Have you learned anything here that you're going to do differently as a result?
I think it's been reinforced here that get past the sales pitch. You have to. And we already know that. That's a lot of what we do. Our leadership will bring new solutions or ideas that they hear about. We'll meet folks and try to surface what's real. But it really reinforces our structure of giving ourselves a safe space to try something on a small scale, to vet it and to really understand what is real. What haven't we considered? How do we embed it in workflows? How do we ensure that we're getting clinician expertise, that we're getting administrative expertise to look at it and really understand how can AI, how can these tools really be meaningful today and not just headline grabbing statement that gets us excited about the future.
Totally. And what are you seeing today that is making the most difference in application?
I think we're starting to see a shift in AI literacy, which is helpful. I think people are starting to, if they haven't already, then they're getting to the point where they're ready to play with some of the generally available AI solutions out there, ChatGPT, Gemini, all of them. You're starting to get more comfortable with it, understand limitations and considerations. And that's really great because then when we reach out to cardiologists or oncologists or anyone to get input on a solution, they're much better able to ask questions, to be open to it, to not have, I think what we saw just as recently as a year ago, sort of a knee-jerk reaction of, no, this is way too complicated of a space. It must be a human. You can't put a robot or any AI in there.
There's more acceptance.
Mm-hmm.
Yeah.
And intrigue too, I think.
And intrigue. And like you said, more literacy, more understanding.
Mm-hmm.
We're starting to, and Agentic is newer. So help us understand what you guys are exploring on the Agentic side.
Yeah. And you know, that term Agentic, just like every term that's been coming out with all of our tech, it's both broad and narrow. You can go into 5 different sites on the internet and they're going to just define it differently. And I think the way that we see it is it's really getting more to autonomous. Everybody has been talking about human in the loop, but you get to Agentic and we're really letting it run. Mm-hmm. And so we're being mindful of finding the right areas for that to be lower risk, opportunity-based. Where are we not meeting patient demand or needs that something like this could help us identify more opportunities? So the big one that we've been really happy about over the last few weeks has been we're using Agentic AI to reach out to patients, to get them in for annual wellness visits, for colorectal cancer screening. And really, it's areas where we know our patient population isn't always proactively coming to us for these things. We've in the past done campaigns where we bring a whole group of people in to make phone calls or to send text messages, but we're still not getting the turnaround and the scheduling and getting our patients in. And then that leads to downstream issues from a health perspective in our communities. And so now we're leveraging AI agents to make those phone calls on our behalf. And they're doing 22 hours of work in 30 minutes. They're getting,
amazing.
10% of these patients are getting scheduled right there on the spot. And what was really impressive is this is a touch point with our patients that we wouldn't have had otherwise, or with our communities that we wouldn't have had otherwise. So we've found suicidal ideation and be able to transfer them to social workers and assistants. We've
That's awesome.
found risks of elder abuse that
Oh, wow.
wouldn't have been sourced otherwise, and we were able to connect them with services. And so it's also a really great way to just give our patients a touch point and identify areas where maybe things are going unseen.
Wow. I love that. And yeah, this opportunity is huge to really help people get to do their wellness stuff that they need to do, because it's hard. And you know what's interesting now, so I run a full service marketing agency. It's interesting to see this channel in particular, right? Is the chief marketing officer part of that at all? Because it's part of the campaign management, right?
Yeah, fair question. So we do include our marketing folks in a lot of the discussions we have. We've been trialing to vet the tech first before we do big promotional discussions out there. We targeted small groups. And so we haven't gone with full on, how do we get this
campaigns
out to, everyone. It's been a, let's vet the tech.
Understood.
It's impressive so far. And then we would go to scaling.
Love it. That's so exciting to hear that. All right. So listen, if you had the chance to go back to when you were 20 years old, what advice would you give yourself?
Can I say two things?
Yeah, absolutely.
So I think career-wise, I'd probably get a degree in a clinical area of study. So I always thought I couldn't be a doctor because the idea of cutting into somebody or blood or things like that was... But I now know, now that I have such a better understanding of the industry, that there are a lot of ways to get that clinical education and understand truly the biology of the human body a lot better. And so I'd probably go that route from a career perspective, because I think it would have it helped.
So would you become a doctor?
I don't know if I'd become a doctor. Maybe a PA or a degree that kind of helps you get that understanding and get closer to patient care. And then personally, it would be, and it was things that everybody tells you all the time, but take care of the body that you have. And it's the only one you have.
It's the only one you have.
And so now, over 40, I am recognizing that some of the things I did in my 20s probably weren't the best choices. And you're trying to constantly overcome that.
Yeah, no, great advice. What is the riskiest thing you've ever done?
I would say I was in college, thought I was going to go into human resources. And I met this company based out of Madison, Wisconsin, who played in the tech in healthcare space. My mother was a coordinator for a physician for a number of years. My dad worked on the business sales side, and it's combined the business and the tech of healthcare.
Yeah.
That company was epic. When I started, they were very small and unknown. They had one building on that campus.
Wow.
And now they are this huge thing. And it was a risk. I had never thought I'd live in Wisconsin, never thought I would get into that kind of work.
Where are you from originally?
Central Illinois. So
you're from Illinois.
Yeah, for the Midwest.
Yeah.
But took a chance on that position, and it has set my career and in many ways my life up in ways I couldn't have even fathomed.
That is awesome. And so how much time did you spend at Epic?
6 years.
So you were there at the beginning and you saw it build. By the time you left, how many buildings did they have?
They had 2 full campuses, with the third being built. The big epicenter training campus had been built. And so it was much bigger than it was when I started.
So that's pretty cool. And so out of that 6-year experience, what would you say you got most out of that? How has it made you different?
They train and educate you as a young person on healthcare, on presentations, on interacting with individuals. I mean, I was 22 years old meeting with physicians and helping to figure out workloads with an electronic record at
cool.
22 years
at 22,
old. I was getting real meaningful impact. And I think that's what got me hooked on how do we help our physicians take care of their communities and their patients and families with technology.
I love that. Yeah. And kudos to Epic, right, for doing that kind of training.
Oh, it was great.
You got to be able to develop your talent. Because as an organizational leader, you cannot put bets on talent. You got to be able, because they'll leave. Mm-hmm. You got to be able to do a combination, hire, but train them so well.
Mm-hmm. And give them the opportunity to show and grow. Because that was it too, is we were young, but in these meetings with individuals who are decision makers at health systems, we were partnered with the brightest individuals developing technology. And it was a great environment to thrive.
That's really great. What's one thing that most people don't know about Northwestern medicine?
Just how big we are. So I think a lot of people see Northwestern and they know the academic campus in downtown Chicago. Mm-hmm. But we actually have 10 other hospitals, 200 physician offices and sites throughout the greater Chicago area. We now have partnerships down in Florida and in London. And so just the scope and impact of
I didn't know
what we're
about
doing
Florida
in
and
our
London.
communities. Yes, we have sites down in Naples.
Oh, interesting.
And then a partnership with a London clinic as well. And so I think a lot of people don't know where all we are hoping to make a difference and change in the world.
Super cool. Well, being a Chicago guy, like I definitely knew about the campuses up north and out west. But Florida, London, that's exciting.
It is.
And being at the head of innovation, I'm sure you're getting an opportunity to vet all sorts of things. And here at AI Med, I'm sure learning some things to help you distinguish signal from noise. What advice would you give to folks that couldn't make it to the conference this time around to how can they best vet through the noise?
I think it's really, and this is a theme that we've heard throughout, is it's just putting structure around how you're going to evaluate and assess these opportunities. And don't just say you have a governance group and everything goes through governance and therefore you have a committee and therefore
the buzzwords.
You're doing it.
Yeah.
But, every single solution, what problem is it solving? Is it doing it in a novel way? Is it doing it with the right type of technology? AI isn't always the answer. And so does this really need to be solved with generative or with agentic or with insert AI here?
Yep.
And then define and measure what success looks like. I think a lot of people say that pilots don't work. You get stuck in pilots, but more often it's simply because you didn't define up front what you were expecting success to look like. You didn't set the metrics and the measures and the factors that you were going to look at to define it. So then as it got turned on, you were pulling that together and it was tough to figure out what you needed to see. So what we've really put some structure around is defining up front and then measuring it and then giving a very set period of time. Either you're able to show the improvement in those outcomes and those measures or you can't. And that's okay. And we have learnings as a result.
I heard the ROI needs to be at least 7 figures. How true is that?
I don't know if I think it depends on how much you put into it.
Okay.
So if it's a $25,000 a year solution, I probably don't need to see that.
Fair.
But if it's a $1 million solution.
Fair enough. Yeah. But, with the bandwidth challenges that we have, like you got to be able to show ROI is the bottom line, right?
Absolutely. And quantifiable. I think a lot of people say, there's some soft ROI. The promise of AI is that it can do things faster, better, more precisely. That should be measurable.
Hard ROI.
You should be able to measure that.
Yes. Well said. Well said. Callie, leave us with a closing thought. And where can people reach out to you to learn more about the work you're doing, the work that Northwestern Medicine's doing?
Yeah, reach out to me via LinkedIn. We have innovation.nm.org now, too. You're going to see some rebranding coming out in the next few months as well. I think always love to hear about it. I would say closing thought is we love to talk to anybody and work with anybody who's trying to dig through the hype, get to the real world application and make a meaningful difference in the halls of our hospitals, into the rooms of our clinics, into the lives of our communities, and our workforce every day. So that's what we're looking for.
I love that. There you have it, folks. Callie Ihde, leading innovation at Northwestern Medicine. Such a pleasure to see you again, Callie. Always good to connect with you and hear the latest.
You as well. Thanks for having me.